How you doing, guys? So this is Dr. Suh at Specific Chiropractic. So in this video, we're going to talk about several conditions. Okay, so the very first thing you're experiencing is dry eyes and dry mouth. Okay, so that's one of the symptoms for Sjogren's disease or Sjogren syndrome. Okay, we also got dealing with let's see what else, endometriosis, right? Constipation, gas and bloating. And also, let's talk about that mid-back pain you also experience. So, tell the viewers about that fun part.
Oh man, it just hurts really. It just hurts really bad, like between my shoulder blades. It feels like something is pinching all the time. It's hard to breathe in deep without raising my arms.
Oh, so you have to literally raise your arms.
Or like I do like this motion and like get a quick deep breath. Every few minutes or so, or try to be discreet about it. But yeah, I first at least noticed the sharpness of the pain a few months ago.
Gotcha. Sjogren's disease or Sjogren syndrome, right? That's basically where the immune cells start attacking your glands in your eyes and in your mouth. Okay. So now, typically, clinically, I've helped several patients with Sjogren's, and it's usually this region of the neck, that region of the nerves that deals with that area. Because if there's a problem, as you see over here, there's nerve interference there, it can affect the mucosal lining of the mouth, the sinuses, and the eyes itself. Okay?
Okay.
Yeah, that's one potential there. Now, another thing I'm going to show to you viewers later on, okay, what also spot off some other issues in you is that we got something down here in the middle part, and that area deals with over here, the stomach. So what we got a Megan blast. So that Megan blast, and I'll show the viewers in a moment. Okay. What's going on is because you're so constipated and you have so much gas being built up, it's sending all the way through the small intestines, and there's supposed to be two sphincters here that's supposed to be closed.
Okay.
Now, when this fellow over here opens up, right, this is what everyone knows. As it comes up the esophagus, heartburn. Okay?
Right.
Now, at this time, it doesn't seem to be open, but you have the bottom one that's open. So since the bottom one is open, just like the sewer gas coming up the kitchen sink, okay, all this gas from the constipation goes trapped and gets stuck in your stomach.
Oh wow.
Yeah, so that's why you
So
feel
I feel bloated.
Bingo, right on the upper part of your belly.
Yeah.
Okay, so that's part of the reason for that fella.
Okay.
And our goal is no, we gotta close that gate from there. Okay. Now other fun stuff. So now let's go down the list, neurological wise. Now we're talking endometriosis. Okay. Now it's usually this region of the nerves. Okay, from here deals with the uterus. Exactly.
Yeah.
Okay, now, here's the thing, okay? The uterus itself, all that lining is supposed to be growing there, okay, each month to prepare to create a nice little house for the future baby.
Right.
Okay. Now, if there's some kind of miscommunication coming from this brain over here and is trying to send all that data into this uterus over here, okay, something's telling us, says, okay guys, start making it. And even though the uterus is, that's weird, it's a little off track. This is not exactly the time to make it.
Yeah.
But it doesn't make a difference. I'm getting the command, I'm getting the information. It's telling me, it says, hey guys, start making it. Okay, that's exactly what's going on. So these guys are only just following instructions from
the
here.
brain.
You got it. And then now this stuff also relay all the information back into the brain. And the brain says, what? I didn't ask for that. What the hell's going on over here?
Yeah.
So then it starts sending all that white blood cells into the area and start investigating, and that's why it gets inflamed and causes even more fun stuff.
Yeah, all the cramps and
Bingo. Right, exactly. And then that tissue keeps on growing even more until to the point they have no choice but to surgically remove it. Okay?
Yeah.
Yeah.
Which happened.
Exactly. So that's why, right, to the viewers, they didn't know that. Yeah, they actually removed her right fallopian tube out to deal with that endometriosis. The problem is the root cause of it is still there. Just like, like like a cell phone conversation. You're trying to order takeout food. It says, hey, can I have it delivered to my apartment B4? What'd you say, B4 or D4? Sounds very similar. But it's getting that miscommunication through down here. So therefore, with chiropractic, what we're going to do is this. I want to investigate your several trouble spots. Okay? That's not relaying the information very well into that uterus itself as over here.
Okay.
So therefore, we're going to take a closer look, see what's going on, try to clear that up, right?
Yeah.
And you also have another potential issue down here, okay? And that's dealing with large intestines and also your sigmoid colon over here. So that's going to touch base on what explanation why you may be experiencing constipation in that area. All right?
Yeah.
The recap of all things: we got dry mouth, dry eyes. Okay. You know, we've also got the GERD, indigestion, gas, bloating, the Megan blast. That's what this is, by the way. Okay. Your stomach is so filled up. See this? That's a gate.
How's that gas?
That's all gas, and it's going right through that sphincter. The sphincter is wide open on you. Okay.
Wow.
Yeah. We also see it on the sideways. Here, see? There's a huge stomach gas.
Wow.
Right there. So we got that mega blast. And then we see all this. This is all your constipation right here. And that's sort of, yeah, but you know, that's where it is. So all that gas backed up, went to the stomach. Okay. And then for all that stuff, we also have the endometriosis. And the final kicker is you also have that mid-back pain where it says, what the heck, I feel better this way, but it's like, I gotta stretch this way to also take some pressure off to make it feel better. So now let's piece all that together, okay? What are the potential neurological problems, okay? So in the bigger picture of things, I wanna take a look, and in the Gonstead method, we take a look at the foundation first. Why? Because just like Leaning Tower of Pisa, if the foundation and the building wall itself is moving all together, why? Because the foundation is not level itself. So we gotta take a look at what's going on in yours. Your foundation, as you see, it's tilting downwards on the left-hand side. So you tell me, if you're like this, can you walk this way? No. Okay? So that's why your body is already readapting, recompensating here at that fourth lumbar vertebrae, tilting that direction. However, see this disc space over here? That is not the same height as this or that or that. I want to see it look more like this. This is very swollen. This is swollen. That's swollen. And in addition to, okay, because by normal, okay, this liquid ball bearing, that's nucleus pulposus, is supposed to be smack in the middle. But when the disc gets damaged, see this ball bearing, it goes backwards. And we see that here on the x-ray. See that circle shape right there? That's not in the middle, that's in the back. See that? Same thing that happened here. That's also in the back. This is also starting to go a little bit in the back. So this fell over here, okay? In essence, because your pelvis got twisted like this so many times, and remember, you're walking and you're rotating your body, so you keep on doing this, it's going to keep aggravating it, and that nerve goes to your uterus. Yeah. So that could be.
That's fascinating.
Yeah, well, everything's all neurologically connected, okay? Then we got that fella, okay, in regards to that. And the other thing is this, I want to see this line over here? I want to see a smack in the middle. You're way off to the left.
Center.
Yeah, so in other words, your pelvis is way off like this, and it's backwards like this, okay? So that's where your body has to kind of twist to readapt for this twist over here. And the problem is, again, even though you adapt for that, you look over here, my head's down this way. How do I get to a head over here?
Yeah.
Yeah, so that's why your body started readapting, doing all these crazy twists like this, all the way to the top. Now, next component is, okay, this region over here, okay, that nerve innervates to your stomach. So by addressing that fellow over there, we want to close off this gate over here, and it should change already for the gas and bloating stuff. Now, we don't see this kind of injury too often, right there, okay? Now, typically when it's misaligned, it's like a little gap like this, but not this big, large gap over here. And she already has arthritis and wearing out around the front part of it. So this fourth dorsal over here, that's in serious trouble over there. So because that thing is so in trouble right there, that could be an explanation why you feel as this hump. I always feel like hunched over right there in the upper part of my back.
Yeah.
And I need to go back, to try to take some pressure off it as well, because since it's so swollen like this one over here, in essence, it's so swollen, it's pinching off the nerve over here. So by like forcing it to squeeze out, you're squeezing and pumping some of the fluid out of the way to try to take some pressure off that nerve. But it's still, that disc is damaged, that's why it's so swollen like this.
Okay.
That's why it doesn't feel fun. You try to breathe and you can't, because this is also connected to your ribs. Now we see here, these are symmetrical, but this rib, see that? That's higher on that fourth dorsal right there.
Mm.
So that's even more evidence that that's in trouble. And look at this one as well. Yeah. Everything's in alignment except that number 4. See how much it bulges out right there?
Yeah, it like sticks out a little bit.
It does stick out. So the reason why it does that is because if you take a look at this model over here, when we rotate and turn, see over here, it's some rotation. That's what normal's supposed to be. But yours, because the whole entire spine, coming from that left hip, you're so twisted up, that force will travel all the way upwards, and what it did to your spine over here is that it's moving so much. That's what you see this part sticking out on the side.
Oh, I see.
So that's what we call a side slip. So that fourth dorsal is side slipping a great deal.
Oh, wow.
So whenever I see that, no, that's not just a little twist. We're talking like as if you got the kitchen rag, you're really wringing that fella out.
Okay.
Oh yeah, you try to squeeze every single little drop out of that fella. And that force also transferred quite a bit twist over here. But that's also what I see here in that fifth cervical over here. This is swollen. And that region of the spine, like I said, in terms of nerve-wise, deals with the mucosal lining. And my expectation is that, and you're going to give us feedback on that one in a bit. Let us know how it is for your eyes and also that dry mouth.
Okay.
All right?
Yeah.
Okay. Any questions?
Is my the neck curve look? The neck's pretty straight. Is that?
Well, no, not just straight.
twisting?
It's going opposite direction.
Okay. Oh, okay.
Yeah.
Yeah.
It's curving this way. Normal is supposed to be like that way.
Yeah. Is that because of all the twisting and like?
Bingo. That's a final defense mechanism for the brain. So when the spine itself is twisted so much, okay, I don't think the head can like spin all 360 degrees. You can't like counter twist all that stuff. So as a final circuit breaker and try to protect the brain stem and the brains and the spinal cord, you deliberately twist the opposite direction. So the only way to get this back is we have to untwist the root cause.
Foundation. You
got it. So this is the fellow that started the whole domino effect. But bottom line is this is right now all my hunches. We're going to confirm that on you during examination. If this truly is the case for this, there.
Yeah.
Right? That's roll. So we're going to start off with visualization, and we want to see if there's any evidence of that defense mechanism. Is there any swelling, any muscle spasms? How's that fellow right there?
It's tender.
Yeah, so we've got quite a bit of muscle spasm there. We have swelling here. Oh, we definitely have a lot of pitting edema right here in that fourth dorsal. Tender right there, yes?
Yeah, very tender.
Yeah, we're going to mark that level right there. It's decent. See, you got this speed bump here. Let's see, over here. See. So all the swelling right there. That's for that fourth lumbar. Let's see. See, you got all this pooling of fluid on the very bottom, at the base of things. See, this is not fat. It's all fluid. Okay, over here, okay, it's all bouncy.
Yeah.
That shouldn't be that way. Okay. So that also tells me that adrenals and everything else is not sucking up the fluid back into your body as well as it should. All right. So because we had that pelvic brim at the very bottom, the pelvic floor.
Yeah.
So basically it's like the basement. So all the fluid in your body, it just sinks down and sinks right over here. So no, this is not fat at all. This is just all fluid. Okay.
Oh, wow.
It shouldn't be this bouncy.
Okay.
Okay. And that's what we have here.
To that.
Okay. What about this? Tender right here?
Tender, yeah.
Yeah. Not too bad here, huh?
Not as bad, but still tender.
How is this one? Not too bad.
Not as bad either.
But
yeah,
that's-
that one is.
So there's that left PIX issue going on over here.
That's,
Tender right there too?
Yeah.
Yeah, there's that fourth lumbar. All right.
how does the fluid get out then? How do we, like, will it just fix itself once we do the adjustments, or is it, how does that work?
When we turn the nerve power back on for your adrenal glands, okay, it's going to start commanding, including your, because the adrenal gland that sits on top of your kidneys, okay?
Right.
It's sort of like the floodgate master on a dam, okay?
Yeah.
So it's going to say, hey, wait a second, we got all this extra fluid all around. Okay, guys, let's start activating the pumps. Let's start pumping all this fluid, get it out of the way.
Okay.
Okay, that's how it goes.
Copy it out, basically.
So what we're doing right now is going to be instrumentation. We're looking for that abnormal temperature that gives off from a damaged tissue. So when the tissue gets damaged, increasing that vascular supply into the area, try to introduce more white blood cells and also other building repair materials to try to stave off that area. Let's see, anything else going on in there? Yeah, you do have a bit at your adrenal glands right there. Okay. I also send it right there, second dorsal. You also have a smaller reading at the fifth cervical as well.
Well, the arthritis, you said that was in one of the, this will go away, or is that like permanently there now?
Which
the
is-
arthritis, you said it's a little bit of arthritis towards the back.
Yeah, as in other words, let's put it as just like a door that went off and rubbing against the frame. Yeah, it's gonna wear that out. That's permanent. But I'm not biomechanically concerned about that area.
Okay.
Why? Because it acts like a tripod. In terms of the spine, it's a 3-point tripod. We had this ball bearing here, and we had the two facets here.
Right.
So it acts like this. So we need to have the tripod like this.
Mm-hmm.
Okay. Now, because the arthritis happened on the very front of it, okay, that's in front of the tripod. I'm not too concerned about it.
Okay.
Now, if you had some damage to it and it causes the whole entire tripod to sink down that way, then yes, we would be concerned. Okay.
Okay.
Right now, no.
No.
It's very minimal arthritis damage in that area.
Okay.
We already confirmed there's quite a bit of swelling. Tenderness right on that one. Yes?
Yes.
Okay. And we also see it. See, it doesn't move too well either. Pain right there, huh?
Yeah.
And see, it's stuck there too. How's that fella right there?
Ooh.
Yeah,
Yes.
it doesn't feel fun, right?
No.
There's that fourth lumbar right there. Check everything else. How's that fella right there?
Yes, like between that one and the one below it was
It's
pinchy.
decent, okay? Now, I'm gonna mark that, okay, as a potential
Right
to look
there.
at.
Ooh, right, definitely right
Yeah,
there.
see, we got something here. I'll mark that again. But the main fella we really want to address is this foot. Yeah, that foot's not happy. 7, okay. Yeah, 2's not happy either. Decent, not great. How's that fella right there?
It's yeah, I can't describe it. It's not as sharp, but it is tender.
Yeah, that's fifth cervical. That's the trouble. Okay, let's get rocking. Here's that fella.
Yeah. It feels lighter. I don't know how to describe it.
Okay.
It's hard to tell yet, but it does feel a little lighter.
Okay, that's good progress.
Yeah.
How's your breathing right now? How's the chest feeling?
Oh, wow. I feel like I have more capacity.
Oh, what was it before to now?
Like it felt like almost like trying to breathe and like my lungs, I guess, being very enclosed, but it feels expanded a little bit actually.
Yeah, that's great. How much better would you say right now for your breathing?
Like percent increase?
Yes.
I'd say maybe a 20% increase.
That's a good start. That's
Yeah.
a good start. Anything else? What about the eyes or any other differences you notice right now?
Not that I can notice right now.
Okay. What about gas bloating? How does that feel?
I can tell better when I'm sitting.
Well, go for
But
it.
yeah, I don't feel as fluffy, if that makes any sense, or as bloated.
Fluffy and okay.
Bloated.
Yep.
Yeah.
I don't know, can we say
That's-
fluffy now?
Well, I don't know.
I don't want to get a copyright violation from the Gabriel Iglesias.
I don't feel as like, because I felt a lot of pressure here, like on my stomach on my left side. I don't know, it feels like it's just expanded, and so I just feel like generally more room.
Okay.
Boy.
There's that fella.
I feel like relieved.
Uh-huh.
I actually feel kind of tingly right now, like in a good way. But in terms of like symptoms, I still feel like I can feel saliva, but I still feel just the sensation of dryness in the back of my throat still. I feel more straight, if that makes any sense, on my hips. I think when my legs was shorter.
Or gas and bloating.
I still feel something here,
Okay.
on the right side, and here. Like,
Gotcha. All right.
yeah.
Well,
I don't feel anything on on this side right now.
Hey, that's a good progress.
Yeah.
There you go.
Ooh. Oh wow.
Here's one. Oh yeah, right there. Drop shoulders. There it is.
Like a crunch I needed. I don't feel the pinching.
Hey, that's good. What else?
Like I can breathe without lifting my my arms. There is still a little bit of tightness right here. But yeah, I don't feel any pain right now. I feel like, I don't know how to describe it. Like released. Like something released, and I'm having a hard time finding my words.
But hey, you can finally breathe there.
But yeah, I can breathe without lifting my arms, which is great. Yeah, like.
So you said 20% improvement last time. How's it now?
Like. Maybe like 60%.
60%.
Yeah.
That's a good start.
Like I still feel a little bit something here and a little bit of tightness here.
Okay. Part of the reason why we didn't adjust your lateral dorsals because the bottom part of your foundation it still needs to unravel itself. Okay. Because since your whole spine is twisted like that way. Okay.
Yeah.
So we're still trying to unravel this way. So let it calm down a bit.
Okay.
And this will also make some more difference. Let's get the rest of it.
Okay.
This is for your dry eyes and dry mouth. Right here fits cervical, but you're gonna drop the belly. Let it all go, let it relax, drop shoulders. There it is.
Wow. Feels like I feel tightness a little bit here. But I just feel more mobile looking up, if that makes any sense.
Yeah.
In terms of the dry eyes and the dry mouth, am I supposed to feel it instantly?
Oh, you tell me. Everyone's going to be different, so that's why we're mapping your nerves. Okay. So that's why we need this feedback.
I mean, I definitely feel like a lot increase of saliva in my mouth, and I have the urge. I got the urge to pass gas, but I don't want to do it in here.
That's okay. You took it smell.
But yeah, I definitely feel an increase in saliva. I don't feel
good.
The biggest thing overall is that I can breathe. I feel like I can breathe better.
Nice.
Yeah, like I feel like I can breathe better, and oh wow, I usually have a constant lower back pain that I'm not feeling right now either, which is good, which is actually really great.
It is a great feeling, isn't it?
Yeah, it is a great feeling. I'm not used to being without pain. Like I'm always in some sort of pain. So this is actually a really new feeling for me.
It's a wonderful feeling.
It's a great, it's like calm. Yeah, it's great.
Another part I forgot to mention about, we both forgot to mention about.
Yeah.
You fractured that elbow while you're skateboarding a couple of years ago.
Roller skating.
I'm sorry, roller skating.
Yes.
Okay, so now it's all healed up, as you can see over here. Okay, it's all healed up. But right now the current problem you have is you just can't.
I can't fully extend it.
Okay, so.
Or I have to really force it.
Okay, so it looks like it feels like roughly about 5 degrees. It's still fixation left in there.
Yeah.
So there's probably some scar tissues in here. Feel that difference over here? See, there's a lot of give here.
Yeah.
But I push this way, it's nice and steel. So, and that's what I see here as well. Okay, got some swelling over there still. There's a little open end gap right here. Tender right there? See, right in the spot? Right there.
It is tender, yeah.
Tender, right?
Oh, yeah.
So that's what I'm saying. So it's swollen right over here. That's what I also see here. There's increased joint space over there. Mm-hmm. So what we're going to do is we're going to pump some of that fluid out of the way before we set it.
That is tender.
Yeah, I know, it's not fun. And then, we've got also a lateral component to this thing as well. Okay, so we're going to pump a little more, and then we're going to set this fella. Yeah.
Oh, not expecting that. Oh wow.
Another deep set.
Oh wow.
Okay, go ahead. Give that a try.
Yeah.
How's it now?
Wow. It feels balanced. Wow.
Yeah.
And it didn't even hurt. Yeah, that's good. That's good.
Oh,
yeah.
thank you.
I feel fully extended. Sorry, Matt. But no, I feel fully extended. No, this has been great. It's like really been great.
So because your body been twisted up and run like a kitchen, a rag for so long, okay, and so many years, your body is going to need time to how to process that unwinding itself. Okay. So you're going to follow our co-pack protocols for all these areas. We're going to talk about that in a bit. Okay. Let it calm down, and we'll see you next visit. And let's get a feedback how things are for your eyes, nose, the Sjogren stuff. What else there? Also, it also affected a bit of your thyroid as well. Mm-hmm. So let us know how your energy, your mood. I believe I forgot to mention about that to the viewers as well, because she did experience some, a drastic hair loss. That's from the hypothyroidism, okay, and the cold hands and cold fingers. Mm-hmm. So you let us know how that's coming about. In addition to the heartburn, the GERD, all that stuff, the gas bloating, and everything else.
Yeah. Okay.
All right. I'll see you next time. Oh, you're very welcome. So how's the dryness and with the eyes and the mouth? How's that coming along?
It's coming along some. It's not fully gone. So what used to happen is in the mornings, mainly, I would find eyelashes stuck to my eyeballs. So that's not happening as much.
Okay, that's good progress.
My mouth isn't as dry. I was wondering if maybe, because one thing I did also stop doing is scrubbing my tongue as roughly, and so I wonder if that had anything to do with it. Mm-hmm. But yes, in terms of the dryness, it's not as intense, but it's not all the way gone, if that makes any sense.
It does. So it's still work in progress. That's great about that one. How's the breathing coming along?
The breathing is good, much better. So I don't have to raise my arms anymore to like take that like breath. I do notice myself still occasionally like just taking a deep breath, but I'm able to just do it, I guess, regularly. There is still a bit of congestion happening, which alternates, you know, the nostrils and whatnot. But yeah, breathing is definitely much easier.
Nice.
Yes.
What other changes you noticed?
Yeah, my lower back pain, it's pretty much gone. Yeah, like so I went on like a 5-hour drive like the day after our appointment, and yeah, usually when I sit for long periods of time or stand for long periods of time, I really, really feel it in that lower back. But that was easy. Yeah, it's pretty easy to drive. I did notice though, so I was I went to visit my family. I was cooking with my sister Sunday night, and I did notice a little bit of tenderness back there. But for the most part, like, I think that's like my favorite part is the lower back pain, because I used to have to hunch over all the time or lean to the side or even lay down, just because it was really, I don't know how to explain it, but it was exhausting type of pain, if that makes any sense. So I don't have that as much anymore, or really at all anymore. So now
that's
it's
great.
just, yeah, so that's really great.
So how's that elbow?
Elbow is like 100% back to normal. It used to feel like kind of off to like extend it, but yeah, it's totally fixed. That's amazing. Another thing I wanted to mention. Yes.
That's it?
Yeah.
Okay. All right. Thanks for the updates.
You're welcome. Everything's going great. For the most part, like, good news, my eyes feel less dry. My mouth feels less dry in the back. There is still a slight roughness on the tongue, but moisture-wise is good. My face feels like the swelling, like, it feels like way less bloated. Like, I used to have a lot of bloating on my sinuses, and right here, I mean, you could really see, I just looked congested. And so I think the last time I did the sinus like adjustment, that like really helped.
And sinus adjustments, yep.
Yes, that really helped. Oh, the breathing is good too. So I'm still not having to lift my arms up.
So you don't have to do that.
Where I'm like, just like a deep breath, and so that's really
that's
great.
big.
And for the most part, my lower back is still good. Like, it used to be really hard to walk long distances. So I haven't had any issues with that, or stairs, or And constipation. Constipation's been, so I used to go like once a week. And
that's some serious backup.
Yeah, you can see it on the X-ray, and also the gas. I have been gas C, which means I'm releasing the gas. I guess that's good. And then I've been going maybe almost every day now. So that's good.
That's great.
Yeah.
Okay. So we're going to keep on working to restore more nerve function. And eventually, and I hope we could get it down to perhaps maybe 2 times a day.
Oh.
We'll see.
Is that normal?
Actually, we want, ideally we want 2 or 3 times a day, because it all comes down to how often you eat. Okay, so a simple way to explain it is this, okay, and this is for the viewers as well, all right? So let's say hypothetically, and we accidentally swallowed 3 marbles, okay? Should 3 marbles come out? Yeah. So if only 2 marbles came out, you says, okay, where's the third?
Right.
Where to go? Okay, so every time you have a meal, there should be a corresponding bowel movement, short time afterwards.
Okay.
I would say really short term, but I said.
Yeah, like throughout the day.
Right, throughout the day, there should be a corresponding bowel movement with that.
Okay.
So if you eat 3 meals a day and only 1 come out, it says, okay, where's the other 2?
That's,
right?
Sitting in there.
You got it. So we want to restore the nerve function, get that conveyor belt moving again, right? So your body can start flushing all those toxins and all that waste out of you.
Yeah.
Right? Okay.
Okay.
Thanks for the updates.
You're welcome.
It's right now 3 weeks, okay? How's your dry mouth and dry eyes coming along?
That's going pretty good. Dry mouth is pretty much gone. My eyes are moist, I guess, so much that like I woke up this morning and I had like kind of crust from tears coming down my eyes, which usually never happens because my eyelids are like so dry that they're like kind of stuck. So it's good.
Well, it's a new fun problem to have.
Yeah.
Right? Okay. Well, thank you for the updates.
You're welcome.